discuss about a important branch of orthodontics, which is cephalometric analysis. And actually, cephalometric is a very mental approach to study the variation of growth among individuals. And by definition, it is one of the branches of orthodontics that deals with the study of skull in different aspects in order to determine the skeletal, dental, or soft tissue changes that can affect the occlusion, and is one the mandatory record to diagnose the orthodontic problems. So basically, it is a two-dimensional image of a three-dimensional human skull, and by this we can differentiate among different types of malocclusions, such as maybe it is due to a skeletal problem, or due to the dental problem, or due to the soft tissue anomalies, as well as we can also check about the prognosis of the patient, as well as the changes which has taken place during the growth of the individual. We can also study it with the help of a Ceph analysis, and moreover, we can also check the changes which is brought about by the orthodontic treatment. We also can study it with the help of a Ceph analysis, and it is very important for the initial diagnosis and the treatment planning of an orthodontic treatment. Okay, so now in this video we will discuss about the basic landmarks of the Ceph, which are useful in the further analysis, which is sagittal, vertical, dental analysis. So shall we begin with the landmarks in this video. For the further analysis, please stick to my videos, and we will discuss it later on. So the basics, first of all, is that the Ceph is of three types. Okay, and the first one is the frontal view or a PA view, and this one view is basically to test the facial symmetry of the patient, and the second one is the lateral view, which is shown in this Ceph, and this lateral view is important for the diagnosis of the skeletal malocclusions, dental or soft tissue related anomalies. And the third one is the oblique view, which is taken in between the frontal and the lateral view, and it is also important in many aspects. The patient which is suitable for the Ceph position is made by the help of Cephalometric. Cephalometric makes the Frankfurt horizontal plane parallel to the floor, so that a proper X-ray beam can pass through the patient's skull, and the distance between a patient's skull and the radiographic source must be 5 feet, which is an important MCQ which often comes in the papers, that the distance between the patient and the X-ray source should be 5 feet, and between the film and the patient should be almost 1 feet. Okay, and now about the basic landmarks. Shall we start now? Basically, it is divided into three parts: the cranium, the nasomaxillary complex, and the mandible. So in cranium, it further divided into unilateral landmarks and the bilateral landmarks. The first of all are the unilateral landmarks. The unilateral landmark first is nasion. I am tracing it with the help of a pointer, but you should trace it with a pencil, never with the pointer. I am doing it to make it more presentable and so that you can easily see it, but it is usually done with the help of pencil. So this is nasion. Nasion is basically at the intersection of the frontal bone and the nasal bone. So this one is the nasal bone, this one is the frontal bone, and this intersection point is the nasion. The second one, which is a unilateral point, is sella, and the sella is basically the imaginary point present at the center of the sella turcica. It is actually a pituitary fossa in which the pituitary gland is present. Okay, and the third, which is the unilateral point, is Bastion. Bastion is present at the base of the skull, which is the two intersecting points, and its tip is the Bastion, which is actually the base of the skull, the intersection of superior and inferior border of the basio-occiput. So this is the Bastion. Now, coming towards the bilateral points. Bilateral points which are present at the both sides of the right and left side of the patient. So first of all is the orbital point. Orbital point is present at the midsection of the inferior orbital ring of the patient. So it is the orbital point, which is OR point. Afterwards there is a Pogonion point, PO. PO is basically the midpoint on superior margin of external auditory meatus. Okay, and then there is a PTM, which marks the ptergomaxillary fissure point, tip of the ptergomaxillary fossa, which is the intersecting point between the interior and posterior margins of a ptergomaxillary fissure. So this point marks the PTM. The fourth point is articulare. This one. This point is called as articulare, and this point is between the between the intersection of the condyle and the basio-occiput, and the point of intersection is articulare. So these are the bilateral points, and the three are the unilateral points. Unilateral are nasion, sala, and bastion, while the bilateral points are orbital, ptergomaxillary, fissure point, and the porion and articulare. Now coming to the nasomaxillary complex. Nasomaxillary complex has a unilateral points which are as the interior nasal spine. Interior nasal spine is the basically interior projection of the hard palate, and then nasal floor, which is interior nasal spine, and its posterior projection is called as the posterior nasal spine, PNS. And then there is a concavity which is present at the labial cortical bone of the palate of the maxilla, which is marked as point A. This is marked as a point A. So this point is the deepest point on the concavity of the contour between ANS and labial cortical plate of the most labially placed maxillary central incisor. Now coming to the mandible. Mandible has a unilateral points as well as bilateral points. The first point is the point B. This one is the point B, which is the deepest point of the labial cortical plate of the mandible of the most interiorly placed incisor. So this point marks the point B. Now the other one is the Pogonion. Pogonion is there. P-O-G, Pog. Pogonion, the interior most prominent point on the outer contour of the bony chin. And then there is menton. Menton is basically present at the most inferior part of the mandible. And while the gnathion is the interior and inferior point on the outer contour of the bony chin. So it is the outer contour and as well as the inferior point. So it is in between the menton and Pogonion, which is gnathion. Posteriorly there is so these are the basically the unilateral points. Now we will discuss about the bilateral, which is present on the right and left side too, which is gonion. The gonion is present at the angle of the mandible. So the posterior and inferior point on the contour of the angle of the mandible is gonion. So this point marks the gonion. Okay, and then there is condylion. Condylion is at the tip of the condyle. So this is the condyle and this is the condylion. So the midpoint of the superior margin of the condyle is condylion. Now these are the bony landmarks. Now we will study about the soft tissue landmarks which are present in the Ceph. The first one is the soft tissue nasion. This is the soft tissue nasion. Soft tissue portion at the intersection of outer contour of the scalp over frontal bone and skin over nasal bone. So this is the soft tissue nasion and it is marked by NS. And then there is pronasale. Pronasale is basically marked at the tip of the nose. So this is the tip of the nose and this is marked as pronasale, PN. And then there is a subnasal. So this patient has actually a rather a straight or a slightly concave labionasal angle, but in some patient it is sharp one and it is well marked at it is basically between at the intersection of the base of the nose and the upper part of the lip. At the point of intersection between the base of the nose and upper part of the lip is known as subnasal. It is actually the junction between the base of the nose and the lip part, and this point is known as subnasal. And the point in between is called as the Steiner's point, which is marked by S. Now the most projecting anterior part of the upper lip is called labia superius, while the most projecting part of the lower lip is called as labia inferius. Okay? And moreover, the soft tissue part of the chin, most projecting soft tissue part which is overlying the skeletal Pogonion is soft tissue Pogonion. So these are the landmarks which are present on the soft tissue. Now there are some points which are constructed points which are not present on the Ceph, but we constructed during the analysis. So we will discuss it when I will tell you about the different planes which are present in the Ceph analysis. So for this video, that's it. Thank you so much.